And these are the bones that we'll be labeling for our video. First one is the clavicle. This is the left clavicle. This end, also known as a collarbone. This end is lateral. This end is medial. And that's about it for the collarbone. Next is the scapula. Alright. First, we're going to come to is the superior border up top. Right here. Or excuse me, superior border, superior angle, inferior angle. And then we have the medial border, the lateral border, the glenoid fossa, acromion process, coracoid process, supraspinous fossa, infraspinous fossa, subscapular fossa, suprascapular notch, and then the spine. This is a humerus. This is the head of the humerus. And here is the anatomical neck. Down here is the surgical neck. Then we have the greater tubercle, lesser tubercle. Then we have the intertubercular groove. We move down and we come to the deltoid tuberosity right here. Next, we move all the way down to the bottom of the bone where you have the trochlea and the capitulum. Then we have the medial epicondyle, lateral epicondyle, coronoid fossa, radial fossa, and then around back is the olecranon fossa. Alright, here we have the ulna. First part of the ulna, we start up at the top. We have the olecranon process. Then in here we have the trochlear notch. Alright, here we have the ulna. First part, we're going to start up at the top. We have the olecranon process. Then we have the trochlear notch. Next we have the coronoid process. Then we move all the way down to the bottom where we have the head, the styloid process, and we come back up to the top, and here is the radial notch. Now we have the radius, where we have the rounded head of the radius, underneath of which is the neck. Then comes the radial tuberosity. Then we move down to the bottom where we have another styloid process. Alright, here we have the hand, where we're going to start down here with the carpals, where there's 8 of them. We have the scaphoid, the lunate, the triquetral. This little bone right here is the pisiform. Then on the back we come to the trapezium right here. Then there's the trapezoid, the capitate, and the hamate. Alright, next we're going to move to the metacarpals. There's 5. Metacarpal 1, also known as the pollex, metacarpal 2, metacarpal 3, metacarpal 4, and metacarpal 5. Next, above that come the phalanges. This is the proximal phalange of the pollex and distal phalange of the pollex, or metacarpal 1. And then this is proximal, middle, and distal of metacarpal number 2, proximal, middle, distal, metacarpal number 3, proximal, middle, distal of metacarpal number 4, and proximal, middle, distal of metacarpal number 5. Alright, now we have the pelvis, and the first part of the pelvis, which is the ilium, which is this big top part right here. Alright, the first thing we're going to come to is the iliac crest, up top here. Then we're going to come to what we call as is, which is the anterior superior iliac spine. Then right underneath that is the anterior inferior iliac spine. Then we're going to move across here to the other side, where we have the posterior superior iliac spine, and below that is the posterior inferior iliac spine. Right underneath both of the posterior spines we have the greater sciatic notch, and then we have the acetabulum. The next part of the pelvis that we're going to come to is the ischium, which is all this right in through here. First thing we're going to come to is the ischial spine, underneath which is the lesser sciatic notch. And then next we're going to come down here to the bottom, right down here, the ischial tuberosity. And then after the ischial tuberosity, we come right in here, this little bone right here, is the ischial ramus. Alright, the last part of the pelvis is the pubis, which is down in here. Alright, the first thing we're going to come to is the superior ramus, which is right up in here. The next thing we're going to have is the inferior ramus. The inferior ramus is down right in here, right here. Alright, next we have the obturator foramen, which is this big hole right here. And finally is the pubic symphysis, excuse me, which is this bottom part right here. Alright, here we have the big bad femur. We have the head, the neck, the greater trochanter, the lesser trochanter, intertrochanteric line, intertrochanteric crest right here. Then we have the gluteal tuberosity. Then comes the linea aspera right down here. Then we're going to have this big one right here is the medial condyle, lateral condyle, medial epicondyle, lateral epicondyle, and then we have the patellar surface. Alright, right here we have the patella, also known as the kneecap. Up top right here we got the base. This is the base of the patella. Then we have the apex, makes a triangle right here. And the way we tell if it's a left or right is we set it down, and whichever way it leans, this is a left patella. Alright, here we have a tibia. First we're going to start up at the top where we have the lateral condyle. We're going to move over here to the medial condyle. Right under both of these we have this little bump right here. This is the tibial tuberosity. Coming straight down, it's pointed right here. This is called the anterior crest, also known as the anterior border, the shin. And then down here, down at the very bottom, we have the medial malleolus. Alright, here we have the fibula. Alright, up top we have the head of the fibula, right underneath which is the neck. Then this long piece is the shaft. Alright, here we have the fibula, where we have the head of the fibula, underneath which is the neck. This long part right here is the shaft. And then down here at the bottom is the lateral malleolus. Alright, the last part we come to is the foot. First thing we have right here is the calcaneus. Next we have the talus. Then right here, this bone, labeled number 64, is the navicular. And then over here, 61, is the cuboid. After the cuboid, right here comes the lateral cuneiform, intermediate cuneiform, and then the medial cuneiform. After which, we have tarsals. These are the tarsals. Tarsal number 1, number 2, number 3, number 4, and number 5. And just like the hand, each tarsal has phalanges. This is the proximal phalange of the phalanx, so it's proximal phalanx, distal phalanx of number 1. And then we have proximal middle distal phalanxes of tarsal 2, proximal middle distal phalanxes of tarsal number 3, proximal middle distal of tarsal number 4, and then proximal middle distal phalanx of number 5. Also, this is the head of the tarsal, and this is the base of the tarsal. So each one, head, base of 1, head, base of 2, head and base of 3, head and base of 4, head and base of 5.